There are two different types of albinism: oculocutaneous albinism and ocular albinism. Oculocutaneous albinism is mainly an autosomal recessive pattern or disorder. Ocular albinism is most commonly type 1, which is an X-linked disorder linked to the OA1 gene. For a basic understanding, albinism is an inherited genetic condition that reduces the amount of melanin pigment formed in the skin, hair, and/or eyes. Basic symptoms include irregular eye movement, lazy and/or cross-eyed eyes, light-colored skin and hair color, sensitivity to light and/or glare, irregular development of the retina, nearsighted or farsightedness, the iris is pink while the pupil is red, and getting sunburnt easily. There are 4 known main subcategories of oculocutaneous albinism, distinguished by their specific skin, hair, eye color, genetic cause, and impact to populations. Type 1 is identified by having white hair, extremely pale skin, and light-colored eyes. Type 2 is less severe and is identified by having creamy white skin and having light yellow, blonde, or light brown hair. In type 3, there is also rufous oculocutaneous albinism, which affects dark-skinned people. People affected have reddish-brown skin, ginger or red hair, and hazel or brown irises. Type 4 has very similar symptoms to type 2. Type 1 and type 2 are the most common, whereas type 3 and 4 are less common. Type 2 normally affects African Americans, Native Americans, and Sub-Saharan Africans. Type 3 usually impacts people from Southern Africa. Type 4 is shown to affect individuals in Japan and Korea more than from other countries. About 1 in 18,000 to 20,000 people have some type of albinism. Methods to diagnose albinism include but are not limited to a physical exam that checks the skin and hair pigment, a thorough eye exam, and genetic testing to find defective genes related to albinism. Although there is no cure for albinism, there are treatments to relieve symptoms and sun damage. Treatments include basic things like sunglasses and protective clothing to protect the body from the sun's UV rays. But there also may be a need to do surgery on the muscles of the eyes to correct abnormal eye movements.